Hi, myself Dr. Sai Kiran, orthopedic surgeon. Today we'll be discussing about shoulder injuries, and with us we have the specialist Dr. Kaushik Reddy, senior orthopedic consultant in Apollo Hospitals. So, sir, we'll be discussing about shoulder injuries, and my first question will be, what are the most common injuries other than the shoulder joint?
See, shoulder joint is one of the most common joints which can get injured. So the common injuries that can happen in a shoulder joint are the first and most common is a shoulder dislocation, then a rotator cuff tear, and fractures around the shoulder joint are also common, then rotator cuff impingement or tendinopathies, and arthritis of the shoulder joint.
Okay. And in which type of people we see most commonly such injuries?
So it depends on the age of the patient, and it also depends on the activity level and whether they are any athlete or any sports person. So like shoulder dislocations are very common in younger adults, and arthritis is common in older people, and rotator cuff tears or rotator cuff impingement is also common in older people, like in 50s or 60s.
Okay. And what will be the symptoms if someone has a shoulder pain?
So shoulder pain, there are different types of a shoulder pain, like a dull aching pain. So dull aching pain usually is seen in rotator cuff problems. If someone has a rotator cuff tear or a rotator cuff impingement, then there will be a dull aching pain. Then there is a sharp shooting type of pain or piercing type of pain. This is seen in people who have impingement syndrome or a rotator cuff inflammation when it is present. Then radiating pain, this can be seen in people who have cervical problems. When there is a cervical radiculopathy and some disc bulge is there in the neck, then they can have a radiating or shooting type of pain which comes from the neck up to the hand. So these are the different types of pain. So based on the type of pain, we can come to a diagnosis, what could be the diagnosis of this shoulder pain.
Okay. And why is the shoulder joint more common as compared to other joints?
So the injuries in the shoulder joint are more common because shoulder joint is the most mobile joint in the body. You can move the shoulder joint 360 degrees. So shoulder joint is a ball and socket joint. So the socket which is present in the shoulder joint is small when compared to the ball of the shoulder, which is a bigger in size. So the ligaments around the shoulder joint have to be intact and have to be strong for the shoulder joint to be stable enough. So that's why the injuries are more common in shoulder joint.
Okay. And I see athletes also nowadays having more in shoulder injuries. Can you just talk about something?
Yeah, so that's because what happens is because the shoulder joint is the most mobile joint in the body, so it can be used or misused more often. So there can be a lot of stress on the shoulder which makes the ligaments loose, and then when the ligaments are stretched beyond the potential what it can stretch, then common injuries for athletes like shoulder dislocations or a rotator cuff tear can happen.
Okay. And what age group specifically we see, as in as young age or old age, what type of injuries we see?
In younger active adults, we see shoulder dislocations, which are common, and older people we see rotator cuff problems.
Okay. In older age, do we have fractures because of their age or something?
Yes, fractures are also common in shoulder. The different fractures which can happen in a shoulder are proximal humerus fractures, that is the shoulder ball which is there, that can fracture, and there can be a clavicle fracture, that is the collarbone fracture, scapula fracture, that is the shoulder blade can also fracture, and glenoid fractures. Glenoid is the socket in the shoulder joint that can also fracture. So the reasons why these fractures can happen in the shoulder joint are like a road traffic accident can cause these fractures, or fall on an outstretched hand. If somebody falls on the hand, they can have these fractures. So these are the different reasons why fractures can happen.
Okay. And what are the types of injuries that you can talk about in the shoulder joint?
So as I told you, the most common injury is a shoulder dislocation. Then rotator cuff tear, rotator cuff inflammation, arthritis. And so these are the most common ones.
Can you just a little elaborate about the dislocations if possible?
Yeah, so dislocation is basically when the ball is not inside the socket. it comes out of the socket, then it is called dislocation. So dislocations are common in young adults. So in dislocation, what happens is because of any sports injury or because of any road traffic accident or any fall, so the ball comes out of the socket. So the person who had this dislocation will have a popping sound. He'll have a bulge in the front of the shoulder. So anterior dislocations are the most common types of shoulder dislocations, because 97% of shoulder dislocations are anterior dislocations only. Anterior dislocation means the ball comes in the front. So it is called anterior dislocation. Other types of dislocations like posterior dislocation can also happen when the shoulder ball goes at the back of the socket. Then inferior dislocation where the ball comes down, or superior dislocation where the ball moves up.
Okay.
So these are different types of dislocations which can happen.
And how do we diagnose it?
So if during any sporting activity or during any kind of injury, if somebody has a sudden pain in the shoulder joint, or a popping sensation, or he feels that the ball has moved from its position and it has come out of the socket, and a sudden severe pain in the shoulder and weakness in the arm. So if somebody has all these symptoms present, then it could be a shoulder dislocation, but he has to confirm it. So he has to visit a doctor. So the doctor will diagnose if he has any shoulder dislocation clinically by checking, and also by advising an X-ray.
X-ray or MRI.
X-ray of the shoulder initially. So X-ray can confirm if there is any shoulder dislocation or not. So if there is a shoulder dislocation, then probably by giving some mild sedation and doing a maneuver, he can reduce the shoulder back into its position. So my suggestion is, a lot of people try to reduce the shoulder by themselves, which they should not do, especially if it is the first time dislocation. Because what happens is, sometimes along with a dislocation, there can be a fracture also.
Okay.
Yeah.
And can you just talk about anything about instability of the shoulder joint?
So basically, shoulder joint, if someone has a dislocation in the shoulder joint, so what happens during a dislocation is the ball hits the socket and it comes out. So there is a structure called labrum, or a cushion-like thing, which protects the ball from coming out. So if someone has a dislocation, then that labrum which protects the ball, there can be a tear to the labrum. So if there is a tear to the labrum, then the structures around the shoulder joint will become loose or lax, and he can have multiple dislocations also. So if somebody is having repeated shoulder dislocations, then it is called an unstable shoulder, or that means that there is an instability in the shoulder joint.
Okay. Can you just tell the audience a little about rotator cuff injuries?
So rotator cuff is a group of 4 muscles which become a tendon, and it attaches to the ball of the shoulder joint. So these 4 muscles are helpful in all the movements of the shoulder joint. So if any of these muscles are torn, so like there is any tear of the rotator cuff, so these tears usually happen because of some trauma, or it can happen because of any wear and tear process, or repeated activity, like a degenerative tear can also happen. So it can be a traumatic tear or a degenerative tear. So usually when someone has a rotator cuff tear, the symptoms that he has is, one is pain in the shoulder joint, and the pain is more in the night, and his sleep is getting disturbed, his activities are getting disturbed, the range of motion starts reducing. So when he tries to raise his hand above the head, he may have pain, or trying to comb his hair or wear a t-shirt may be difficult. So these are some of the symptoms which can be there with a rotator cuff tear. So if someone is having any of these symptoms, then if he consults a doctor, he'll do a few tests to examine, and MRI is the diagnostic test for identifying a rotator cuff tear. Sometimes it can be a partial tear of the rotator cuff or a complete tear of the rotator cuff. That can be confirmed on an MRI.
And what are the types of rotator cuff injuries?
So the rotator cuff injuries can be ranging from a simple strain of the rotator cuff, or it can be a partial tear of the rotator cuff where some fibers of the rotator cuff may be torn, or it can be a complete tear of the rotator cuff where the rotator cuff which attaches to the ball may be torn completely and it may be away from the ball.
Okay. So basically, we need MRI to be for the diagnosis.
Yes.
And once the MRI is done, how long is it will it take to decide if surgery is needed, or
Yes.
what will be the further instructions
Yeah.
to be taken?
So basically, if someone, if the MRI suggests that it is just a strain of the rotator cuff or an inflammation of the rotator cuff tendon, then they don't need any kind of surgery. Probably rest and some exercises, good physiotherapy should be enough for them. Then if it is a partial tear, sometimes they may need an injection in the shoulder which will reduce the inflammation, and then by doing good rehab they'll get back to normalcy. But if it is a complete tear, then most of them will end up in a surgery if it is a complete tear, because the problem with a complete tear of the rotator cuff is the tendon starts retracting. That means once it is ripped off from the bone, then it starts going back. So there will be a retraction of the rotator cuff tendon. So once there is no support for the ball of the shoulder joint, then the ball starts going up. So when the ball starts going up, it will rub against the bone which is there on the top of the ball of the shoulder, and they can end up in arthritis of the shoulder.
Okay. So, and what are the most common injuries in older age?
So older age, rotator cuff problems are more common in older age, because the tendon can get injured or torn because of any fall, or without fall also, like just with wear and tear, degeneration can cause a rotator cuff tear, or rotator cuff inflammation is also very common thing, especially for people who are doing overhead activities like teachers or people who play tennis, badminton. They can have these rotator cuff inflammation of the tendon, and arthritis of the shoulder, even though it is not that common in the shoulder joint arthritis as compared to a knee or a hip arthritis. Shoulder joint arthritis also can occur. Like primary arthritis of the shoulder joint is rare, but it can happen. Rheumatoid patients who are having rheumatoid arthritis can have arthritis in the shoulder, or it can be because of some pre-existing trauma to the shoulder joint, can cause a secondary arthritis in the shoulder joint.
So, can this rotator cuff heal by itself?
Yeah, if it is a simple tear, a small tear, then it can heal by itself. But if it is a complete tear of the rotator cuff, and patient is having a lot of pain in the shoulder and he has developed weakness in the shoulder, then it doesn't heal by itself. In those cases, surgery is required.
Okay. And what will be the physiotherapy? What is the importance of physiotherapy in shoulder?
Physiotherapy is very important in the shoulder, because whether surgery is done or surgery is not done, physiotherapy plays a major role in the shoulder rehab. Because when someone has any injury and there is a tear or an inflammation of the shoulder joint, by giving physiotherapy initially in the form of measures to reduce the pain and inflammation initially, and then what happens is, because there is pain in the shoulder joint, people will stop moving the shoulder joint, and that can develop stiffness or a frozen shoulder, which is again a very common thing in the shoulder joint. So the limitation of movement will happen. So that's why even if there is a pain in the shoulder joint, they should keep moving the shoulder. Otherwise it will become a stiff shoulder. That's where the physiotherapy will be helpful.
And what will be the role of physiotherapy post-operatively if a patient is getting a rotator cuff repaired?
So after a rotator cuff repair surgery, physiotherapy, initially after a rotator cuff repair, first 4 to 6 weeks we have to give rest to the shoulder joint by giving a shoulder sling. So everybody will get a shoulder sling for about 4 to 6 weeks. So till 4 to 6 weeks they can move their elbow, wrist, fingers, and do some pendulum exercises of the shoulder. And physiotherapist's role will be minimal during the first 4 to 6 weeks. The main role of the physiotherapist will start after this 6 weeks. That's when they'll start with passive movement exercises. Then they'll shift to active assisted exercises, active exercises. So good physiotherapy for about 3 months is ideal, because that is the time we have to give for the tendon to heal back to the bone. So no excessive strain to the shoulder.
Okay.
The repair site for the first 3 months is important for any rotator cuff repair.
Okay. So basically, if after 3 months of physiotherapy, can the patient get back to normal routine daily activities he is doing?
Yes, of course. They can do every activity what they used to do earlier after shoulder arthroscopic rotator cuff repair surgery.
Will there be any restrictions that they should be avoiding after surgeries?
No. Initially, yes. Initially, for the first 3 to 4 months, they need to avoid playing any sport, avoid lifting weights, avoid straining the shoulder.
Okay.
But once they get back the movement, once they get back the strength in the shoulder muscles, then they'll be able to do everything. They'll be able to play tennis, they'll be able to play badminton,
Okay.
they'll be able to do all the activities what they can do before that.
Okay. And one last thing, I want you to introduce something about Apollo to the audience.
So here at Apollo Hospitals, Jubilee Hills, we have all the facilities in diagnosing these shoulder problems by the latest advanced MRI scans, ultrasound scans. So we can diagnose any type of shoulder problem, and once we diagnose these shoulder problems, we have all the latest advanced surgery options here available with us. We do all the latest surgical techniques or surgical procedures, whatever have been done by people all over the world, are being done here. So if anybody has any shoulder pain, any shoulder problems, then please do come and seek the expert opinion here at Apollo Health City, Jubilee Hills, Hyderabad. And we are there here to take care of any kind of shoulder pain or shoulder problems or shoulder injuries. Thank you very much.
The link is there in the description. Yeah. Thank you, Doctor Sir.
Thank you. Thank you,
Thank
Doctor.
you.